So there's no sort of better than, it's more what's appropriate for each individual. So for some people who have worn dentures for a very long time, have not had teeth for a very long time, providing them with 4 implants, with fixed teeth that they can eat with, that they can sort of get their life back in some way, in some circumstances, then 4 is more than sufficient. But for others who maybe are younger patients who have very strong bites, for example, they would really benefit from having the support of having 2 extra implants at the back of the jaw. So there is no specific sort of blanket rule for everybody. It will purely be based on what is right for you.
6 is fantastic, and if you can get 6 in the mouth, perfect. Because if 1 fails, you've got 5 more still to use. In some situations, 4 is ideal for that patient because they may not need more than 4. But where possible, I always say to patients, more is better than less.
So pterygoids have actually been around for quite some time, but there's definitely been a lot of sort of scaremongering about pterygoid implants that, you know, you're going to hit some very important structures or that things can go wrong. It is quite a specialist procedure in that it's something that takes time to sort of master. But once you have, it then means that you have some really, usually very solid pieces of bone to be able to place implants into at the very back of the jaw. So they're generally very stable. It allows you to avoid big procedures such as sinus grafting, which can come with its own complications. So where possible, we would rather use somebody's own bone rather than doing a big complicated procedure to add artificial bone to that patient. So it means in most cases you can avoid sinus grafting altogether, which isn't often offered as much as you would hope.
I'll give you an example. I saw a patient last week here in Dartford. The patient had gone to quite a few other clinics and was told it's not possible, they need bone grafting. They saw me, sat down, within 20 minutes I knew we can help this patient. And the patient was really happy because they said, are you saying I don't need grafting? No, you don't need grafting, because we're able to engage a special part of the top jaw where most dentists are not always trained in putting implants there. That means that we can negate the need for bone grafting or sinus lifts and all these other complex procedures which delay treatment. And it means that we are able to give, in most cases, 6 implants and fixed in teeth on those 6.
So at EvoDental, all of our clinicians are trained to place pterygoid implants. We have a very strict training pathway to ensure that we are all sort of kept to the same standard, and we want to be able to offer our patients the best. And in our opinion, if you're not able to offer pterygoids, then anything you are offering is a compromise. So we want to make sure that we are doing what's right for our patients in all cases.
You can't just have one material. I trained as a specialist in prosthodontics, and one of the key things for us and what make us tick is materials and understanding forces. So, you know, a patient who's, you know, big and strong and got big, strong muscles, they are really going to grind through whatever prosthetic that they have in their mouth. Now, sometimes it's actually good to have a bit of a fuse within the prosthetic and the rehabilitation you're giving the patient. So say, for example, someone is a heavy grinder and they've got a really brittle material inside their mouth. Something has to give, and it's usually the material. So we want to give something maybe a little bit softer that will allow them to grind and wear the material in. And in those situations, you may want to go for more something like a PMMA or an acrylic or composite type material. Whereas in patients who, you know, don't really grind to that extent, those who have maybe suffered from things like gum disease in the past and don't have strong forces, they're the patients that I'll be more inclined to offer zirconia, because it's a much stronger material and it's not as forgiving as something like PMMA. Now, if you'd ask me, Ricky, what would you have in your mouth? Me personally, I would want zirconia on the top. But because I'm a grinder, I'd probably want PMMA on the lower jaw. But that may not always be the case for everyone. And another question people ask is, well, I grind my teeth, I want to benefit from zirconia as well. There's nothing wrong with you having it, but your bite, your occlusion, has to be dialed in. There's no room for error. And the benefit of us here at Evo is, you know, we all train to a high standard, and we've got, you know, specialists as part of the team as well, who are all just as pedantic as I am when it comes to checking bites. So, no one material fits all. We have to tailor it to different patients.
I think that's like anything. If you try and blanket prescribe one material for every single person or one drug to fix every disease, it's never going to work. So you have to make sure that you're doing a very bespoke treatment plan for each patient. And that involves the number of implants, it involves the way we set up and design their teeth and the materials that they're made from. So we want to always be able to tailor our treatment plans for each individual to make sure we're offering the best and we're not blanket prescribing one material. So it's becoming more commonplace to see the option to have full arch treatment done within general dental practices. And it feels like the landscape in general of full arch treatments is really changing and becoming more and more complex. But we want to be able to offer all of our patients a solution. And at EvoDental, any patient who comes through our door, we can guarantee there will be a solution for you. So we can offer all the different levels of complexities, from using pterygoid implants, which is fairly mainstream for us, to other types of implants that you may have heard of, such as transnasal implants, zygomatic implants, and even something called subperiosteal implants. We've placed all of these throughout the years at EvoDental. So it means that every patient that comes to us, we can say, you will leave with fixed teeth on the day.
No one size fits all. A patient who has a small mouth may benefit from something like all-on-4 implants. But a patient who has a wider smile and bigger jaws, they may benefit from more implants. And sometimes people don't always have bone towards the back of the mouth, so particularly in the top jaw as well. So if we're able to engage extra maxillary areas, i.e. areas that are outside of the maxilla, and the maxilla is our top jaw, then that opens up the possibility of being able to treat patients who once probably weren't able to be treated at all. So that's the key benefit. Pterygoids in particular have really changed the way that I treat my patients and what I can offer them. Sometimes you don't have bone even in the middle of the jawbone, and that's where the cheek implants, the zygomatic ones, come into play. Then you've got situations where we're even worse off than that, and that's where subperiosteals come into play. These are highly complex, highly specialized types of implants, and they're a little bit different to the traditional ones that we place. So I'm sure that we can have some pictures come up on this video showcasing what they are, because trying to explain it, well, that just showcases how complex they really are.
Over the years of treating patients, the great thing of having those years of experience and just how many thousands of implants, tens of thousands of implants we've placed, it gives us the reassurance as the clinicians to know that we can definitely provide a predictable outcome, that we can get those patients really sort of efficiently through their full arch journey and get them to the end, get them to having their teeth back, feeling like themselves again, but knowing that we can do it every single time. There's no question of, oh, are we going to be able to do this case? We've seen it all, essentially. And so we know that any patient that comes through our door, we can provide them with a solution.